Hello, everyone. Take your seats, please. So thank you for joining us this week for the second annual CMS Health Equity Conference, hosted by the CMS Office of Minority Health. I'm just so touched by the amazing work I've seen here in the last 2 days. And I just really want to thank each of you for taking the time away from your desks, jobs, families. Just a few quick numbers. We had over 100 speakers, 625 plus in-person attendees from 46 states that joined us this week. Over the last 2 days, I've seen breakout rooms that have been overflowing. We're standing room only here in the ballroom on several occasions. So we're so grateful to all of you, including people traveling near and far, those who drove hours, those who sat on an airplane unexpectedly for 3 hours, and everything in between. And for those 4,000 plus who joined us virtually, we see and love your comments in the chat. Thank you for all your questions and discussions. I know we've all learned so much to move us forward and really help us learn, share, and imagine health and inspire health equity to take home and use in our work. And I feel particularly inspired as the new Chief Health Equity Officer here at CMS and Director of the Office of Minority Health to carry this work on and keep this work in action. And so what a really wonderful way to close my second week here. And I could just not be more grateful to the speakers, the audience, the stakeholders, and everyone who had input into making this conference a true look at health equity across our healthcare system. So thank you all for showing up in the name of health equity, and CMS looks forward to continuing to showing up with you every day. And in particular, I want to call out Dr. Maybank's keynote yesterday, which reminded us all to stay dedicated to our commitment through our actions, to face up when our actions don't meet those commitments. And as she said, we must fight, disrupt, and dismantle, not just in spurts, but consistently. And so that word, consistently, is so important. And that's why our theme this year was focusing on sustaining health equity through action. We want to focus on sustainability for health equity to give you something to take home, take back to your organization, think through your work, and act on it. Act on what you can do now, what you can plan ahead, and what each of us can do for health equity. And so my call to action, my challenge to each of you is to sustain that activity in the coming year, and then come report back on it next year in 2025. So sustain your engagement with each other, with CMS, and with our communities. So please act on the lessons you had these last 2 days. Whatever that good idea you heard in a breakout session, that fascinating training you saw on a poster, the resource you picked up at one of the federal exhibits, take it, use it, and act on it. Together, we will sustain health equity, but we must act now. So I'm just so inspired by all the awesome health equity work I've heard over the last 2 days, and really the wonderful audience joining us in person and virtually. So in addition to all of us here, I know there are even more colleagues in your offices waiting to hear our next steps. We must act now, though, together. So as we wrap up our second Health Equity Conference, I would be remiss if I didn't take a moment to acknowledge all the effort and hard work of the CMS Office of Minority Health team who worked so tirelessly over the past 12 months to put this conference together. So whether you are here in the ballroom or in one of the breakout rooms where this is streaming, if you are an CMS OMH team member, please stand up, raise your hand, let folks know who you are, and just round of applause, please. Don't forget, please look out for our conference survey We value your feedback on the conference as we do on any topic, and we want to be sure to make sure any future events are responsive to your needs. So please scan the QR code on your badge or look out for a link from our conference team in your inbox. So please be sure to subscribe to the CMS OMH newsletter for updates on this office's work throughout the year. And thank you again, and hope to see everyone in 2025. Thanks again.